All right. Hello, everyone. My name is Gretchen O'Connor. I'm a physical therapist here at Grace Lake Rehab, and this is a recording of my workshop, What Can I Do About My Incontinence? I'm going to share the screen here with a slide presentation. There we go. Okay. Move me out of the way. And again, what can I do about my incontinence? And our Kegel is the only answer. A little background on myself. I'm a physical therapist. I have been for about 33 years. I took a long time off when my kids were little, stay home with them and raise them about 4.5 years ago as our youngest was looking at colleges. We were running the numbers and decided it was time for me to get back to paid work as opposed to just the work that I was doing at home. One of the things that I found really interesting as I came back to the profession was that my interest and my focus, as well as the professions, had really evolved. And what I started to discover and learned along the way was that our body is not just a group of parts, but systems that interacted and worked with each other. We no longer were treating, and I no longer looked at a problem as a shoulder problem or a knee problem or a foot problem, but how that problem interplayed and interconnected with the rest of the body and how it affected everything. What I also came to discover was that breathing, core, and pelvic floor are the foundation for all of our movements. And if we don't have a good breathing pattern, good abdominal pressure control, good endurance and strength for all those core muscles and all of the movement that goes along with that, we're going to injure ourselves when we do something simple, seemingly simple, like try to get up and down off the floor, lift a bag of groceries, or lift something heavy out of the oven. One of my focuses here at Grace Lake Rehab and in my practice as a physical therapist is to try and help people move easier through life. And as I started working on that, that became my focus as far as the breathing and core control and how that all interplays. So onto a little bit of pelvic floor and incontinence. What is incontinence in general? Lack of voluntary control of either urine or bowel, and it can run the gamut between just the urge, like I got to go quickly and now, or I dribble a little bit or lose full control. Sometimes it's just gas you can't control. Other times you lose control over bowels as well. And it can be anywhere along that spectrum or include a couple different issues. One of the things I found interesting as I was researching for this presentation was the increase in pelvic floor disorders, incontinence issues, pelvic organ prolapse that are projected to happen from 2010 up to 2050. I don't think this is just the population getting older, the baby boomers coming of age and reaching the point where these things tend to be more common. As we'll see in a minute, I think there's a lot of different factors that are affecting this. And I think the treatments that are currently being offered are helpful, but they don't completely address all the underlying causes. I mentioned before I had 4 kids. And after I had my kids, they were all C-sections. I had a little bit of issue with incontinence, but I definitely realized and felt that I just couldn't control my bladder the way I could before. With the kids about 2 years apart, it helped that somebody was always potty training, and that enabled me to keep looking for a bathroom for that kid, but I also found it was for me. One of the things that I found really frustrating was that years later, when the kids got older and I started getting back to some running and trying to do some strength training, that's when I started having problems again. And that was frustrating because I didn't think that I had done anything wrong or done anything to contribute to that. When I mentioned it to my doctor, this, oh, you're just getting older. You've had 4 kids. That's normal. What happens at this point in time as you're getting older. Well, as I did my research and started looking, what I came to find out and discover and truly believe is that this is not normal. I firmly believe our bodies were meant to be strong and carry us through life until we are done with them. I also think our bodies have an incredible ability to heal given the right input. It's not to say that everybody can get back to where they were when they were 20 or 30 years old physically, but I do think we can improve from where we are right now. One of the challenges with pelvic floor strength and core control, but the pelvic floor especially, is that we know what the consequences are when that pelvic floor is not working, our incontinence, whether it be bowel or bladder. But as far as what it feels like when it is working or when it's not working, what those muscles feel like when they contract or relax, we just don't kind of have that sensation. And then once we do get that, we need to very carefully and safely progress based on how our body is doing. checking in with our body, listening to what it's telling us is really important to how quickly we progress. Whenever you start an exercise program, say for running or weight training or strengthening, for example, you don't start off hiking up a 10-mile mountain. You start off with a simple walk around the block or just an easy walk, jog interval. Or you don't start off lifting 200 pounds. You start off with a lighter weight, maybe work on that pattern, see how your body is limited or not, work on those limitations and progress safely from there so you don't injure yourself again. Same thing should happen when we're strengthening our pelvic floor and connecting that to the rest of our body and the movement that we're trying to do. So when we look at some of the causes, there's a lot of different causes that might be contributing to pelvic floor issues and to incontinence in general. When you look down this list, most of us can probably tick off 2, 3, maybe even 4 or 5 different causes, which leads me to believe that part of the challenge is that one thing isn't going to solve the whole problem. When I look down that list, I definitely have a bunch of them. I don't consider age and weakness direct causes. I think of that more as lack of use or lack of movement and not using those things, and that use it or lose it, losing control over those muscles and them not working as well, I think are really important as we get older. Lives get busy. We don't always move the same way. We don't always exercise the same way. And I think that's a portion of what is causing some of the incontinence that we all experience. Some of the other risk factors, and again, when you look down that list, some of these things we have, some of these we don't. A lot of these we can control for, others we can't control for. But until we start to address some of the things that we do have the opportunity to improve, we don't know how effective our pelvic floor can work and how much it can get better until we start to move it differently. When I look at the treatment options currently available, the first 3 I think of as more like a Band-Aid. They can help and they can get better, but if those underlying causes are more than just a medication that's going to help it, or we go for that surgery and we don't address the underlying weakness or lack of movement, that's not going to be as successful as it could be. I also think that even if you end up opting for one of those first 3 treatment options, working on the strength of the pelvic floor muscles, changing some of the behavioral habits that I'll talk about later, can really improve the outcome of those first 3 options. Again, when we go back to those underlying causes and risk factors, oftentimes it's more than one thing. So addressing it and helping to treat that incontinence and that pelvic floor weakness and lack of good function is going to take more than one treatment, not just one thing will solve the whole problem. I'm going to refer questions to the end of the presentation. I'll have my email address and phone number there. Please feel free to reach out to me. So when we see our doctor along the way and we mention that we have some issues with our incontinence, bowel or bladder, they might give us a medication. They may refer us to somebody who could help us with a surgery. If you start to discuss any conservative treatments, they say, oh, just try some Kegels, it'll work. Well, one of the challenges with a Kegel that I think we'll get into, and I think you'll understand better in a moment, is that it's not always what you do, but oftentimes how you do it. And as I started to learn more and work with women and myself on incontinence and getting those pelvic floor muscles activated, a Kegel is not a Kegel, is not a Kegel, a more effective way to do it and a less effective way to do it. So we'll get into that, a little bit of that in a minute. I think it'll help you understand a little more when I describe some of the anatomy of what goes into the pelvic floor and as well as the core and how they're all connected. So when we start looking at anatomy, we look at the skeletal system and our bones, and this is really the framework for our body. Once we take and overlay the muscles onto the bones, this is where things start to look a little bit more complicated and a lot more detailed. What I basically want you to understand when you look at this muscular system is that there's a lot of overlapping, there's a lot of interconnectedness with the muscles. So what's happening in one area can definitely affect what's happening elsewhere. And if something's not working in one place, it doesn't mean that the problem is in that place, but oftentimes the problem is elsewhere. I think this will help understand when we talk about the core. When a lot of people think of the core, they think of the abdominal muscles. What I want you to think about is a canister. And the top of that canister is the diaphragm, the breathing muscle that I'll show you a picture of in a moment. The middle are the abdominal muscles, and the bottom of that canister are the pelvic floor muscles. So all of those parts, that core canister, to work together efficiently and effectively, needs all 3 parts contributing, not just 1 or 2. So let's get into the details here. The diaphragm muscle, if you look on the picture on the left, there's just your rib cage. Think of the diaphragm as an umbrella that sits underneath the rib cage. That's the main breathing muscle. And as you're breathing, that muscle will drop down a little bit. And as you exhale or breathe out, that muscle will come back up. I'll go through some of that in a moment when we practice some of the breathing and you try and see what it feels like for you. When you look at the picture on the right, you can see how that diaphragm sits in relation to the rest of the body. Again, under that rib cage, connects to the rib cage, there's that other piece that drops down a little bit that attaches to your spine. One of the important functions of that diaphragm muscle is to keep the spine stable, particularly the low back or the lumbar spine. If that diaphragm is not strong, if you don't have a good belly breathing pattern, that could contribute to some low back issues. And oftentimes when I see patients that have incontinence or they have pelvic floor issues, they don't have a good deep breathing pattern. They also have a little problem with their low back pain, sometimes in the hip, sometimes in the low back, anywhere along there. But again, that breathing muscle is really important to stabilize that area. Like I said, we'll get into some breathing in just a minute. I want to share a picture of the abdominal muscles. What a lot of people think of when they think of the abdominal muscles are the six pack, and that's the portion in the middle. But there's a couple more layers that go around the sides and the back of your torso that actually contribute to and are part of the abdominal muscles. If you only work those front muscles, you're missing a lot of the rest of that canister that should work to function so that you have good core control and can move safely through life. So let me back up here for a minute. If I were to slice that belly in half, pull out the insides, and then look down into your pelvis, these are the pelvic floor muscles. And looking at the picture, the bottom of the screen is your bottom, your backside, your spine, and then at the top of the screen is your belly, the front part of your pelvic bowl. Again, like the muscles in the rest of your body, they go a lot of different directions. There's a lot of overlapping. So there's a lot of opportunity for everybody to work together. And when only some of these muscles are working and not all of them, that changes how the pelvic floor functions. You can think of the pelvic floor muscles like a little mini trampoline or a sling that help to hold up the organs up above them, primarily the bowel and the bladder, but everything else up above that as well. So how do you make the connection and how do all these things work together? Let's go through some breathing. I'm going to back up here a little bit so you can see me. So what I'm going to have you start with is a little bit of movement through your pelvis. I talked before about the pelvic bowl. And if you think of your pelvis as a bowl and full of water, when you're sitting right on your sits bones, the pelvis will be level. If you really gently rock forward so that bowl tips a little forward, you can imagine water spilling out the front. If you tip backwards, you can imagine water spilling out the back, okay? So be careful how far you move, and I don't want you to force it and go through comfort and into pain. You should have a little bit of movement back and forth in that pelvic bowl, like you're going, if you tip forward, it almost feels like you're leaning forward towards that pubic bone. If you tip back, you almost feel like you're kind of resting on that tailbone. And if you come to the middle again, you're sitting right on those sits bones. So what I'm going to do is forget about the diaphragm and the abdominals right now. We're just going to see what it feels like to get those pelvic floor muscles working and relaxing. See what that feels like for you. So let's do the tip back. So you're sitting on the tailbone. What I want you to think about is if you were to pass gas, go ahead and try and stop that gas and then relax and let it go. And then try and stop the gas again and relax and let it go. Okay. Now have you switch and go the other direction. Come on forward so you feel like you're sitting, putting more pressure on your pubic bone in the front. What I want you to think about in this position is stopping pee and then relax and let it go. And then stop that pee and relax and let it go. Okay, so I'm going to have you come to the middle. So you're sitting on those two sits bones. You're not forward, you're not back. That pelvis is level. No water is spilling in either direction. What I want you to think about at this time is combining those two. So I want you to stop the gas, stop the pee, and then relax and let things fall out. I'm going to make another little adjustment here. What I want you to also think about, if you've ever used a tampon, is as you stop the gas and the pee, gently lift and pull that tampon back up and in, and then relax and let that tampon drop out as you let the gas and the pee go. And then go ahead and stop the gas, stop the pee, lift that tampon up and in, and then relax and let it go. So keep working on that. I just want to touch on a couple things. Some of you may find you have a really hard time relaxing and letting go in the front or the back. Some of you may feel like I can let it go, but I just can't contract and lift it up. You should be able to feel like those muscles are contracting or stopping and also lifting just a little bit. You should also feel like it's the muscles on the inside of that pelvis that are working. If you haven't used those muscles in a long time and they're really weak and you're having a real hard time doing it, some of you may feel like I'm working my glutes too, or I got my legs working, or I feel like my neck is helping out. All of that is normal when those muscles are not used to doing the work that they should. So one of the things you want to work on is gently contracting and lifting, and then gently relaxing. You should be able to go both ways with that. So let's set the pelvic floor muscles aside for a minute. I want to go through some breathing with you. And again, back to that diaphragm. It's like a little umbrella that sits underneath the rib cage. And as you breathe in, that diaphragm drops down. And as you breathe out, the diaphragm lifts up. So underneath that diaphragm are all the contents of your belly, all the way around here. So as that diaphragm drops down, those contents need to go somewhere. And where they should go is a little bit of pressure out this way. They can also go down towards that pelvic bowl. So as you take that breath in and that diaphragm drops, you should feel things expanding. You should feel a little pressure down into that pelvic bowl. So what I'm going to have you do is breathe in and out through your nose, close your mouth, leave your tongue resting on the roof of your mouth behind your front teeth. And I'll show you first from the front and then I'll show you from the side. Rest your hands on the soft part of your belly. And as you inhale through your nose, feel the hands spread. And then as you exhale through your nose, feel it come back in. And then inhale. And then exhale. Let me show you from the side here. Right? And let me see if I can pull this down a little bit. Right? So as I inhale, and then exhale. Okay. So my hands almost feels like their thumbs are spreading from the fingers and then coming back closer, and then spreading apart and coming back closer. If you're somebody who's been breathing from your neck and your upper body for a long period of time, that diaphragm isn't very strong and it won't move very far. As you continue to work on your breathing, though, you should feel like it's going further, like that belly is expanding more and more. And again, the second piece of that is that as that diaphragm drops down, it just doesn't expand here. It should put pressure down into your pelvic bowl and a little pressure on the bowel and the bladder. What I think it feels like when you get a good deep breath down into that pelvic bowl is that you put a little pressure on that bladder. It feels like you almost got to pee a little bit, or you might pass gas a little bit. But then once you exhale, that pressure comes off and everything feels normal again. So again, in and out comfortably through your nose. Okay. So how does it connect to the pelvic floor? Go back to that idea of a canister, that core canister, and the top is a diaphragm and the bottom is that pelvic floor. And as you breathe in, think of those as two little mini trampolines. As you breathe in and that diaphragm drops down, the pelvic floor should also relax and drop down. And as you exhale and that diaphragm comes back up, the pelvic floor should contract and lift a little bit. So they kind of do this little dance back and forth together. So just so you can check your breathing again, rest your hands on your belly. And what I want you to think about as you're doing that inhale this time is relaxing that pelvic floor. And then as you do the exhale, think about stopping the gas, stopping the pee, and lifting the tampon back up and in again. Okay, so go ahead, inhale through the nose. Pelvic floor relaxes, gas and pee fall out. And then exhale, gently stop the gas, the pee, and lift that tampon back up and again. Okay, go ahead, inhale through your nose. Pressure goes down, pelvic floor relaxes, things drop out, and then exhale. Stop the gas, stop the pee, lift the tampon up and in. And then inhale again. Pelvic floor relaxes, and then exhale. pelvic floor contracts and gently lifts. If your pelvic floor hasn't really been working very well in a number of years, what oftentimes happens is as you breathe in, it wants to go, they're working opposite of each other. Instead of this nice little dance back and forth, you're breathing in, that pelvic floor is contracting, you're exhaling, that pelvic floor is relaxing. So one of the things you want to work on is that connection back and forth between the diaphragm breathing in, pelvic floor relaxing, breathing out, and the pelvic floor contracting and lifting. So the diaphragm and pelvic floor are doing this nice little back and forth with each other. So how do the abdominals start to work here? They already are doing a little bit of work with the breathing that you're doing. I'm going to have you just change the emphasis on your exhale, and instead of breathing out through your nose, breathe out through your mouth. Still rest your hands on your sides, okay? And then inhale through your nose. Everything relaxes, and then on the exhale, as you're breathing out through your mouth, push it really hard. So really forcing that air out at the end. Inhale again through your nose. Pelvic floor is relaxing. And then on the exhale, as you're breathing out through your mouth, pelvic floor is contracting and lifting, and you're forcing all the air out of your lungs. So one of the things you should notice at the end is that those abdominals start to contract as you're forcing that air out. Now you've got that whole canister working back together. The inhale, the pelvic floor dropping down and relaxing, and then the exhale, diaphragm coming up, pelvic floor contracting, and the abdominals contracting as well. So as you do that, and it gets more comfortable and you get better control over it, there's a couple different ways those pelvic floor muscles have to work. They need to be a very conscious effort, but you also need to be able to have them reflexively and very quickly contract. When you cough or sneeze, for example, or you go to lift something up that might be falling. You can't always slow down, pause, think, contract that pelvic floor, coordinate it with my breathing, and get it all working the right way. So one of the ways you can start to work on that quick reflex with the pelvic floor is to change your breathing again. So I'm going to have you, if you're comfortable, rest yourself, elbows on your knees. So you're putting a little pressure on the front, and this is going to direct that breathing down into that pelvic bowl. From here, what I'm going to have you do is breathe in through your nose, a series of short, quick inhales. So, and then relax and exhale. And another series of inhales. And then exhale. One more set. And then exhale. So what you should start to feel as you're doing those short, quick inhales is that the little bit of pressure and a little bit of a bounce from the diaphragm onto that pelvic floor. And it'll start to feel like things are automatically kind of kicking in and contracting and lifting just a little bit. Now you're not lifting anything heavy, it's just a short little breath. So it shouldn't feel like it's really working hard, but it should feel like there's a little bounce back and forth with the pelvic floor and the diaphragm. So how often should you do this? I'm gonna come back to the screen here. All right, so how often should you do this? Hold on a sec. I apologize, technical difficulties. All right, let me go back here. Thank you for your patience. There we go. So I often get asked the question, how often should you do this? If you don't have a really good breathing pattern, what I suggest you start with is anywhere from 3 to 5 minutes of that deep belly breathing 3 times a day, breakfast, lunch, and dinner. Follow that with some of the short, quick inhales, anywhere from 6 to 10 repetitions with a comfortable exhale in between, anywhere from 3 to 5 sets of that. What you should find is that if you're consistent about doing it, within about a week or two, the amount of incontinence that you have or how much control you have over that incontinence should start to improve a little bit. Again, questions, I'll refer you to my email and phone number here at work at the end. Talked a little bit about habits and how you can change some of your bladder habits, but also some of your habits just during the day. The movement that we do and the postures that we're in for long periods of time can definitely have a negative effect on our pelvic floor, on the strength of it, and how our body is working all together. A lot of the time that we spend on our computers and on screens right now have us sitting for long periods of time. Those muscles don't work when we sit. They start to relax, they get weak. We don't always exercise the way that we should. When we get up to go do some movement, we might go for a walk around the block and not really do any strength exercises. Strength training is really important to keep things solid enough and have enough endurance, enough strength to safely move through our day. So I strongly recommend, if you had been doing some strength exercises and you haven't done them lately, get back to that. If you don't have a good strengthening program, search out and find one. And if you need help, we could arrange that here at Grace Lake Rehab. So some of the bladder habits, these are from Sarah Duvall, who's a PT. Her company is Core Exercise Solutions. She's got some great information out there. So bearing down when you pee, drinking enough fluid, but not always fluids that irritate you. Oftentimes people are, their pelvic floor tends to relax a little more so when they drink things like caffeine, or that have caffeine in it, or that have a lot of sugary, have a lot of sugar in them. So check with your body, see what it feels like when you do have a lot of these things. If that irritates and makes your incontinence worse, you're going to want to stay away from foods or drinks and foods that have those things in it. The just in case pee, not allowing your bladder to fill as far as it should, and also overfilling, which is the last one, and not getting to the bathroom in time. The bladder is a muscle and it should be able to fill to a certain point and empty all the way down. But if we overfill or don't allow it to fill enough, either extreme is going to have an impact on our incontinence. Hovering over the toilet as opposed to sitting all the way down. It's hard to do on a public toilet, but when you're home, when you're in someplace you're comfortable, you should sit all the way back down again. Okay. When you think about those core muscles, think about a tube of toothpaste. And when the cap is on that tube of toothpaste, you can go ahead and squeeze that back and forth, and that pressure will stay inside that tube. That cap is off just a little bit and you start squeezing again, you could have some leakage out the side from that cap. Now you get rid of that cap altogether and you put pressure down, and now you have a lot of leakage. When you think of only working your abdominal muscles or only working the breathing without the pelvic floor, that's a little bit about what happens with the incontinence. That example of the tube of toothpaste is kind of rudimentary, but it's very similar. I mentioned exercise before and things that I like to do before I had my kids. I like to run, I like to strength train. While I had the kids and they were little, I didn't do much more than walking and biking. And as I got a little bit older, I definitely mentioned earlier that I had some incontinence issues, or definitely that I had to go more often. Once I started to connect those dots and put things together again and started working on my core, things started to feel a lot better. So I decided I wanted to run another marathon after I had had my kids when I turned 50. I had done a marathon previously before I had kids, and then wanted to get back to it again. As I started doing the strength exercises and I started running again, I was real careful to keep up those strength exercises and progress the running very cautiously as well. Kept checking in with my body. What did the pelvic floor feel like? How did my core, how were things working or not working? How did things feel? And adjusted as I could. When I ran my marathon, I did get my personal best, just under 5 hours. I'm not fast and I'm not good at it, but I was really happy to do that. What I really noticed was that other than being sore from running the 26.2 miles, I didn't have another injury like I had chased for the rest of my physical life. Things felt good. I could once again move easy through life. And that was probably the most rewarding part. So again, my name is Gretchen O'Connor. Thank you very much for joining me here. If you do have any questions, there's my email address and phone number here at Grace Lake Rehab. And if you have any issues, if you have an individual question or you'd like to schedule an appointment, we can arrange that at either one of those areas. Again, I appreciate you joining me and watching here from Grace Lake Rehab, where we help you travel the shortest distance from injury to recovery.